Well, hello, this is Health Matters with me, Dishen Kumar. And in previous episodes, we've been trying to show you, the viewer, on the story about diseases, different perspectives on diseases. But today we're going to do something a bit more different. We are going to be talking about these guys, smartphones. Now, as a patient, when we go and see a doctor in a hospital, sometimes doctors need to communicate or even ask advice from other doctors to try to find out what is our problem. But what is the best way to do this? We have all these social media messaging apps, but is our data being protected? So what we're going to do in today's episode, we're going to be talking about communication or miscommunication in the hospital, and also maybe there is an app on the phone that actually help doctors to communicate better and work smarter. So join me in today's episode. This is Health Matters with me, Dishen Kumar. All right, thank you, Dr. Nur Anita Harun, for joining us today. Very interesting conversation we're going to have today. We have to talk about now doctors in hospitals. There is going to be a lot of communication amongst doctors, and one of the most important things is also protecting patient data. What are your thoughts on that?
Right, that's a very interesting question, and it's very timely. The most important thing about patient data is about, for me, it's really about upholding doctors' integrity and making sure patients' autonomy is preserved. Those are the two things. And you can see data protection is very well highlighted in all the guidelines, in the Code of Professional Practice, and it is one of the core tenets of our ethics. So there's no two ways about it. So protecting data is something that is very, very important, especially now with the advancement of technology. You are having electronic information. Those days when we were medical students and doctors on the ward, we have protection of data as well. We're not allowed to have corridor consultations, nor cafeteria discussions. And but now, today, it's all electronic. And now, how do we nudge? How do we nudge those medical students, doctors, healthcare professionals, the health community? How do we tell them, look, you have electronic data at your fingertips. How do you make sure that you keep to your code of ethics? So that's my thoughts on that.
Now, the interesting part of it is, because I'm not a doctor, I wouldn't know what a doctor goes through every day. And even people watching at home, they wouldn't know what a doctor goes through every day. So how important is, especially for young doctors, to communicate their cases and to have that discussion? How important is that?
Extremely important. I can't emphasize more. Let me tell you a scenario. In the medical fraternity, there are the housemen, the medical officers, the specialists, and the consultants. And especially if you work in a very busy hospital, I mean tertiary, quaternary hospitals, where you really have to juggle within your on-call period. In Malaysia is very long. I wouldn't say how long, but it's very, very long. You have to juggle multiple cases at any one time. Because the way it works, one person on call for the medical, one person for the surgical with their hierarchical consultants, you have to actually interrelate in between sections, in medical and surgery, or even within the medical fraternity. So you can imagine how many cases you see in a night. So it's very important. So communications is so important. Yeah.
Okay. Now, talking about that, the challenges doctors face with the caseload and things like that, based on what you have gone through in your own professional line, would you welcome a secure digital way of communicating with other doctors?
Of course. That goes without saying, because I'll tell you a scenario, because I probably have gone through the pager era. We have a little pager there. Yeah, you remember the beep that comes up? I feel so good with that pager, because no one can disturb you. Yeah. But anyway, the pager is there, and you can see a number. And by the number, oh, this is a neurology ward. This is the cardiology ward. Then the next thing you need to do is, oh, where do I get a phone to call in? Now, that's time. especially if you work in big hospitals like Kuala Lumpur, Hospital Kuala Lumpur, which I was working years ago. You had to travel from one end to the other, and that really is it's really a stress on a young doctor. But you need to get things done immediately, and time is very important. So if you tell me I have a digital app or something that I can communicate immediately and with a precise information going on board, not through a second channel, that would be lovely. At the end of the day, the role of the doctor is to create a safe environment for the patient. I tell you the steps, yeah? The minute the patient walks into your clinic door, there's already trust within the patient and you. So once they have that trust, then only you can take the history. You're talking about saving lives, yeah? So once you can take his story, which is history, then you build in that confidentiality within the environment. Now, he's telling you something about his own self in confidence. Now, you got to build that up, and then you got to create a very private environment. It's privacy. And then only you can have a safe and secure platform. Now, because of this, saving lives is the utmost importance, because when the patient comes in to the emergency unit or to the ward or to the clinic, it's all about, please help me. I have a problem, please solve it. It's all about diagnosis and treatment for the doctor, but it's all about, I want to get better for the patient. So for us, even in the codes of ethics, saving lives is utmost important, but in a safe and secure environment. Now, back to the patient's data protection, yes, you must maintain confidentiality. But within doing that, you must remember, not all cases are emergency cases that you have to quickly get the patient's data. No, most of it, 90% or 80% of the time, it's a clinic environment, it's in a ward environment. The one that you need to protect is how you manage the organization of the workforce. You see, encryption of the data. Don't share passwords with your colleagues. Make sure that the authorization, the process of authorizing who gets into the computer has to be, you know, certain people getting to the computer. So these things are little things which sometimes in a busy environment you just can't make sure that it's there. But that's the role of the whole administrative task force in the hospital organization.
Okay. Now, final question for you. I've been putting you on the spot the whole time after this, but if you want to introduce something new into the industry, doctors, being doctors, they have a way of working all these years. How do you think you can eliminate something that actually helps them, social media messaging and things like that? How can you actually say that this is not really safe, you got to use something else? How do you change that mentality, being a doctor yourself?
You know what, Dedish? It's really difficult. You know,
Yes.
doctors being doctors,
Doctors
they're
being
all
doctors,
set,
yeah.
embedded in their minds, their
Yeah.
own principles. But having said that, I think the key word here is about patient-driven. Doctors are always patient-driven. You are here to help the patient. If the patient needs it, then I will conform to what he needs. So I think, yes, policy up there, yes, protocols, but it's the patient. And when I say patient means the patient themselves too, in the society, the public, they need to know, they need to have the awareness that not only the doctors are there to protect their data, they themselves need to protect their own data. So I give you an example why I say this. If you look in Facebook or WhatsApp, you know, and somebody wants to tell something about his family member or his friend who's sick in hospital, well and good. But you can see suddenly a picture coming out of the poor patient in the ICU, in the CCU, and he doesn't even know that someone's taking his photo. So where is the dignity of that patient? He's not there to defend himself. So for me, I mean, as for the group of doctors, we feel that even along the wards or the corridors, patients themselves need to think and wait a minute, I'm taking a picture of my dad, he's not well, is that something my dad would like? To have his photo viral on Facebook. That's one. Number two is about raising funds. You can see pictures about abnormal babies or newborns or anything, you know, and some gruesome photos of somebody. It's a being, you know. It doesn't matter whether you know or not. It's still a human, you know, being viraled, and say, look, this person needs help, and look, he's you know, he's got neurofibromatosis. I feel that as much as you want to raise funds for these people, it has to be done in a very discreet manner, and it should be only given to certain organizations for help, not to be thrown all around the world. Because I think perhaps the money will be there, but when the patient is much better, it's embarrassing to know that my data is all around the world. I've got $1 million for this, but people now know that I have a genetic problem. So that's my point of view. I may, you know, that's...
And we have photos who suddenly get re-uploaded and all these photos never really leave the internet.
No,
like that.
And so that will haunt the patient for the rest of his life. So if you're talking about the way doctors' behavior change, at the end of the day, it's, like I said, it's your integrity as a doctor. Go by the code of professional practice, your ethical code, and at the same time, coax your patient, understand, and try to tell the patient too that their data is actually within their hands. And this is actually, if I may say, the core end of what we call a patient-centered practice. No more is the doctor the king. The paternalistic decisions made by doctors of yesteryears has gone far. We must now move towards the patient being in the center, and we are supporting the patient from within.
All right. Thank you, Doctor, for your time.
You're most welcome.
All right, welcome back. This is Health Matters with me, Dishen, Kumar, and today's topic, we're talking about the communication aspect of a doctor's daily life. When talking about patients' data, talking about patients' information, what doctors can actually do to improve or protect patient data while communicating with other doctors in hospitals when they are actually working and things like that. So with me today we have Dr. Izam Mat Ali, who is the CEO and founder of MedPlanner Sdn Bhd. Thank you, Doctor, for joining us today.
Welcome.
And let's start off with something that your company has created, an app that is designed to help doctors called Circles.MD, correct? So what, can you explain a bit more about that app?
Okay, so Circles.MD is basically a secure clinical messaging app for everyday patient management. The whole idea is that doctors can communicate discussing patients on daily basis when they manage patients. Instead of using social instant messaging, they have a dedicated messaging app which only healthcare professionals are a member of, with the ultimate aim to improve patient care.
Now, talking about the healthcare community and things like that, how is it important in protecting that patient data? Because that was one of the biggest issues with social messaging apps is a photo that's been shared or some information that's been shared can be forwarded to anybody else. So there's not much of protection. So what does Circles.MD change in that sense?
Okay, so our security features, for example, are to do with the infrastructure and how we've designed it. When I mention infrastructure, it's basically the digital health standards to protect patient health information. So digital health standards, for example, are HIPAA compliance and ISO 27001 compliance. Okay. In terms of the actual experience of the doctors using the app, how we make it secure, for example, it's not possible for them to forward messages. Okay. And the other thing is a closed network. Everyone is a healthcare professionals. And every single case is by invitation only. Okay, so each case will be only discussed with members of the clinical team that has been created for the team leader. And other security functions, for example, every single clinical photo or clinical images, for example, is taken from within the app. Okay. So this is one of the requirements for digital health standards. You must not store any patient data on the phone. And this is different, as we know, with social messaging apps, unless you really go through the privacy and security settings. But with this app, you upload the app, and then you take a picture. And the picture will be stored in the cloud. Okay? Again, the cloud security is approved and met the standards for HIPAA and ISO 27001.
Okay.
Yeah.
Let's talk about, we've talked about patients, protecting data and things like that. What about the benefits to the users, the clinicians? What does Circles.MD provide for them?
Okay. So although the ultimate aim of this app is to benefit patient care, expedite their care, but the immediate benefit is actually to the users. Users here being the healthcare professionals. Okay, the benefits as we have developed this for, because this is developed by clinicians, for clinicians. Okay, so the benefits, for example, is it will be easier for them to work smarter. Okay, work smarter because the app has been designed for clinical working. So, for example, if they want to refer patients, if they want to ask for specialist advice or hand over patients, we have features for that. Okay, this is fairly, is very unique as an app for messaging in itself. Okay? For example, in Circles.MD, you have you can create a clinical team, okay, and then another clinical team looking after the same patient. These two teams can have a common discussion. Okay? So what I like to do is to come back to the this asking for a specialist advice feature. Junior doctors especially say to me that when they ask for specialist advice, it can be quite nerve-wracking for them. Okay? And when you look at research done on clinical messaging, something like this app is a great way to break down the hierarchical barrier between specialists and junior doctors. So you formalize the referral process. So because you're formalizing the referral process, the activity can happen quicker to get advice from specialists, for example. So there's benefits for the users in terms of clinical, how they can work smarter. But also, which I haven't touched in any of the during this interview at all, is that we also have other features, okay, for learning and growth and for networking. So we have a feature called Buletin. Okay, so where doctors can actually subscribe to specific medical bulletins that interest them.
Oh wow, okay.
Yeah.
So you have information coming into the app as well?
Yes,
okay.
yes, and they also can publish something from their team. If you have a cardiology team from a hospital here, if you want others to know about it, say if you've achieved something or there's a latest guideline, you can publish it where others can subscribe to it.
Interesting, interesting. And talking about networking, you were saying?
Yes, so networking, doctors can create teams of network. For example, say in Klang Valley, so if they create a team of network where doctors in general medicine, for example, will have a network of where they can refer. Okay, so they can build that. So for example, if they want to refer to a liver specialist or neuro specialist, they can have all of that created as a network of referral, for example, where they can work more efficiently. Yeah. It can also work as a peer support for junior doctors. We hear a lot of things about junior doctors working too hard, junior doctors requiring a lot of support. These are all true, and they can support each other through this app using one of the feature for peer support, which is the chat feature.
Now, talking about doctors and doctors being doctors, you want to change, by bringing in this app, you want to change how they do their everyday work. If they've been always using a specific app, how do you think that you need to change the mentality of the doctors, thinking like, no, I've been using this app all this long, why should I be using? They will always question the why. Why should they be using this app? So how do you do that? How do you handle that change of mentality?
First of all, I think the most important message, if I'm faced with a group of junior doctors or the hospital groups, I would say to them, we're actually not changing the way they are doing things in terms of messaging. We are merely replacing it with something that is dedicated for clinical messaging. So we're just replacing it. But as we know, with anything new that's being introduced anywhere, and especially in healthcare, because people are busy, there will be suspicions, there will be resistance, but there are ways to overcome this. So you were alluding to how you change that mentality. Okay? So this will require change management. Okay? And change management in healthcare is very challenging. It requires a top-down approach and bottom-up approach, and also changes in policies. Okay? So top-down will be from clinical leaders and healthcare management, and from the Ministry of Health. Bottom-up will be the workforce, and I always think about the millennial doctors. They are the future of healthcare, and they embrace technology easily.
Okay, interesting. So that particular patient data, organizing patient data, because I'm not a doctor, I wouldn't know what a doctor goes through throughout their life. So for the people watching at home, why is it important for them to organize patient data? How many types of cases does a doctor go through? We don't really know that. So maybe we can talk about how that actually helps, say, a junior doctor starting work. They don't know what's happening around them and things like that. I believe in the earlier interview, Dr. Anita was saying that she used to carry a notebook, and she used to have like every page for every patient. So how important is that organizing patient data? And does that disorganization, if there is a disorganization or a miscommunication, how detrimental is that for the patient health?
Right. Let me answer that last question first. There is data on this, and a lot of this kind of data comes from America, because they are more established in terms of looking at the impact of hospital activity on patient care. So a report by CRICO, for example, Control Risk Insurance Company, they looked at the impact of poor communications on patients. So this is poor communication within hospitals. They have shown that I think over a period of a year, 2,000 lives were affected.
2,000 lives
were affected from poor communication. And 37% of medical litigation cases resulted in severe injury to the patients from poor communication.
Wow, that's a very high number.
I don't think it's difficult to get this kind of data in Malaysia, because we don't really measure this kind of things. America is really good at this. UK has some data, but the best data comes from the US. So that's in terms of the impact on patients. Okay? So coming back to the other parts of your questions, on day-to-day basis, okay, if doctors don't have an efficient way to communicate, okay, clinical communication is at the heart of medical care in hospitals, right? Then they can't make quicker decisions. And the best example will be when you're discharging a patient. Okay? One patient may have more than one team looking after them. Okay? So a patient in cardiology may have a renal team looking after them, or a neurology team looking after them as well. Okay? Sometimes you just need an okay from one of the teams to discharge the patients, okay? Because doctors are busy. So you need a true collaborative clinical platform where these conversations can take place. Okay? Because it's a bespoke clinical messaging app in Circles, the different teams can have the common information about the patients already there to to inform them how to come to a decisions. Okay? So in hospitals, poor communications, the best example on how it impacts patients is the delay in discharge. So delay in discharge is a real problem for hospitals because then you're blocking up beds, right? And also problems for patients, because the longer patients stay in hospitals, they can get this thing we call hospital-acquired infection. Yeah? So it's not good for the public hospitals, actually not good for the private hospitals as well. So the longer patients stay in hospitals, private hospitals don't actually make money after a certain length of time, because they make money in the first few days of admission.
Can we see any future implementations of Circles.MD? Do you see any other applications that it may move into towards the future and things like that?
Yes. So, Dishen, this is just the beginning. Okay. So, in Matt Planner's vision for digital health, we believe that we should start with the healthcare professionals. Okay, because they are the bread and butter of the workforce. Okay? If they are all entrenched in and embrace the digital health, I think then it will be easier to open up portals, for example, to patients. Okay? So we do have in our roadmap for the next app to be our patient app.
Oh, a patient app. Wow.
Yes.
Okay.
Yeah.
Okay.
Yes.
All right. So all the best to you. All the best to Matt Planner. Thank you so much, Dr. Izam, for your time.
Yes.
And thank you for watching. This has been Health Matters with me, Dishen Kumar. We talked today about communication. It's very important in our lives, but from the perspective of doctors, how doctors' communication can actually, miscommunication can actually affect you as a patient, and what do we need to do to improve that. So I hope you enjoyed this show. To all doctors watching, maybe it's time for you to actually change, move away from these social media messaging platforms and things like that, and look into apps like Circles.MD. So I hope you have enjoyed this show. This is Health Matters with me, Dishen Kumar. I'll see you in the next episode. Goodbye.